Now, when it comes to diet, Malaysians have a very special relationship with our diet. We love our food. How does diet influence the health of our stomachs, doctor?
The stomach plays an important role in food storage and food processing, and the harsh environment in the stomach can protect us from harmful microbes. Gastric mucosa is the first line of defense, and there are a number of factors that are responsible for gastric mucosal damage, including alcohol intake, smoking, stress, drug usage. And microbial factor Helicobacter pylori. These risk factors can lead to the development of gastritis, peptic ulcer, and even gastric cancer. Helicobacter pylori is considered as a risk microbial factor that causes chronic active gastritis and subsequent peptic ulcer disease, and in some cases, even atrophic gastritis and gastric cancer. Smoking may impair mucosal integrity and increase the risk for peptic ulcer, while alcohol intake has been associated with an increased risk of peptic ulcer bleeding. Other dietary factors do not directly affect gastric function, but may influence the long-term risk of gastric cancer. Chronic gastritis, which is often developed from gastric mucosal injury, is still one of the most common forms of gastric disease. It is associated with some severe diseases such as peptic ulcer or gastric cancer. In the early stage of gastric mucosal injury, we name it sub-health stage. Functional food and healthy lifestyle are encouraged. Food-grade ingredients could give us better nutrition and protect us from various diseases with less side effects. However, when the situation is getting worse, chronic gastritis can take place, and this can further lead to the development of peptic ulcer and even gastric cancer. To this point, drug treatment is necessary, and it often causes significant side effects. So timely change in lifestyle and functional food supplements can be effective to prevent gastric mucosal injury from transforming into diseases. In clinical, gastroscopy is often used to assess gastric mucosal condition. In a typical gastroscopy test, a doctor is likely to observe the color, bleeding points, hyperemia, and everything of the gastric mucosa. However, for most people, gastroscopy is not a pleasant experience. When you have these symptoms, including indigestion, bloating, heartburn, belching, stomachache, poor appetite, hiccup, etc., you should pay more attention to your stomach because these are early signs of stomach damage.
Can you explain a little bit more, doctor, for our understanding about modern herbal nutrition that is carried into this particular product?
Stomach health product is another product that follows modern herbal nutrition. The ingredients used in this formula include traditional herbal ginger and jujube, which could fortify spleen and nourish stomach, and the modern science-based ingredient kelp extract and wheat peptide, which could protect gastric mucosa, the same as eye health product. We have also conducted many in vitro and in vivo studies, and even conducted a double-blind, placebo-controlled human clinical study to substantiate the claim of gastric mucosal protection. This stomach health product was launched in China last March. The Chinese name is 保卫, means protecting your stomach.
There are a lot of interesting names that go into this product that we're familiar with, but we've never seen before in this combination. Botanical beverage apple, jujube, and wheat peptide. What are the important ingredients that play a vital role within this product, Doctor?
Wheat peptide is the first ingredient that draws our attention. It is a hydrolyzed product of wheat protein. Compared with wheat protein, wheat peptide is easy to absorb and rich in glutamine. The content of glutamine in wheat peptide is about 20%. Previous studies have proven that glutamine has protective effects against gastric mucosal damage caused by non-steroidal anti-inflammatory drugs. So, it is a critical function for wheat peptide to provide glutamine for restoring gastric mucosa. Besides, other studies have proven that wheat peptide could maintain the integrity of epithelial cell. Wheat peptide is very safe and has been used as novel food ingredients in China for 10 years. Another ingredient we considered is kelp extract, which is rich in a bioactive polysaccharide, fucoidan. Accumulated evidence has proven the effects of fucoidan on gastrointestinal health via Helicobacter pylori, inhibition and anti-inflammation. Fucoidan has multiple health benefits. On one hand, it could cover the whole gastric mucous surface, bind the mucus receptor to prevent from the harmful factors. On another hand, it could competitively bind to Helicobacter pylori to inhibit its colonization on gastric mucosa. According to the latest research, fucoidan could improve gastric mucosal injury by inhibiting gastric inflammatory factors, including interleukin-6, tumor necrosis factor alpha, interferon gamma, etc. This slide summarizes the scientific evidence that can support the benefits of fucoidan on gastrointestinal health. We have conducted multiple in-house assays to validate the effects and mechanism of fucoidan and wheat peptide, and found these two ingredients have antioxidant, anti-inflammation, anti-Helicobacter pylori properties, and can enhance gastric barrier function. Interestingly, we observed complementary effects between kelp extract and wheat peptide. Kelp extract has better effects on inhibiting inflammation, interleukin-8 inhibition, whereas wheat peptide shows better effects for barrier protection. The combination of both may provide holistic protection for stomach health. Then, the function of wheat peptide and fucoidan combination has been further validated in rat model, where ethanol was used to induce gastric mucosal damage. The stomach tissue was examined by histopathological evaluation. As shown in the left two graphs, we can find that oral intake of ethanol induced severe damage to the stomach tissue, as well as degeneration and necrosis of the mucosal epithelial cells. However, the combination WPF intervention effectively attenuated ethanol-induced gastric mucosal damage, with the pathological index improved by 70%. Moreover, we also determined a number of blood markers levels by ELISA methods, including MDA, a marker for oxidative stress level, SOD, an antioxidation enzyme, inflammatory factor interleukin-8, platelet activating factor PAF, gastroprotective factors PGE2 and EGF. The results indicated that WPF could maintain MDA to a normal level and increase the level of SOD, suggesting their antioxidant effect, and could inhibit interleukin-8 and PAF. suggesting their anti-inflammation effect, and could induce gastroprotective factors, PGE2 and EGF secretion to promote cell survival, suggesting their pro-survival effect. These results have been published in the peer-reviewed journal Nutrients in 2017, provide strong scientific evidence to support the function of WPF on gastric mucosal protection.
Okay, this is the question for all the cynics and skeptics out there. Was there any clinical trial done on this new product, just like the previous one?
In addition to those preclinical studies, we also conducted a double-blind, placebo-controlled human clinical study in Shanghai with 106 gastric mucosal damage subjects to prove the benefits of WPF on stomach health. This slide describes a brief workflow of performing human clinical trial. Participants were randomized to receive WPF and placebo once daily for 45 days. Pathological grading of gastric mucosal damage was scored using gastroscopy. Questionnaires for self-reported gastrointestinal discomforts, life quality, and food frequency were collected throughout the study. Fecal samples were collected for the determination of calprotectin, short-chain fatty acids levels, and metagenomics analysis. After WPF intervention for 45 days, we observed that the gastromucosal condition, including erythema and redness of 70% subjects were improved by gastroscopy test. And the WPF group reported less occurrence of stomach pain, belching, bloating, acid reflux, and loss of appetite compared with the placebo group. And after 45 days intervention, the WPF group showed overall improvement in food intake and life quality. Moreover, the WPF intervention significantly decreased the fecal calprotectin level while slightly increased the fecal short-chain fatty acids level. An elevated intestinal calprotectin concentration is often associated with gut inflammation in the lower part of gastrointestinal tract. Together with the results from gut microbiota analysis, we can conclude that WPF may alleviate gastrointestinal inflammation through the alteration of gut microbiota. And this slide shows the effect of WPF on gut microbiota. Genomics data is too complicated to be understood, and I will not go into details. Here, we just need to know that WPF increased the abundance of certain members of the gut microbiota, such as bifidobacterium strains, and this may be linked to the increased production of short-chain fatty acids. In summary, this clinical trial validated the benefits of WPF in gastric mucosal protection. WPF reduced gastric mucosal damage level, reduced the occurrence of stomach pain, belching, bloating, acid reflux, and loss of appetite, improved life quality, and increased food intake. Besides, the results from this trial suggest a potential benefit of WPF to the lower gastrointestinal tract by altering the gut microbiome profile and short-chain fatty acid production. These results have been published in the top nutrition journal, European Journal of Nutrition, in 2019.
Where there are skeptics, there are even bigger skeptics, which will ask, are the journals available for all the clinical trials? Doctor.
So far, 2 papers have been published for stomach health products to support its claim on gastric mucosal protection. If some of you might be interested in these papers, you can contact us for the full text.
Can you share with us more about traceability? behind this new formula?
Neutralized traceability philosophy deeply roots in every product, goes beyond the systems for documenting the production of each lot of products. In this stomach health product, we established the traceability for kelp extract. We finished the program of choosing beneficial botanicals, designing our finished products, and qualifying our supplies from the seed to extract. We start with the end in mind, the benefits and the experience we want to deliver to our customers. Then use each of these steps to document our work along the way. By the time we are ready to ship, we can be sure that we have a high quality product that is pure, safe, and effective.
As usual, we saved the best question for last, the big one, the one that you guys want the answers to. What are the unique selling points, doctor, for this particular product?
In summary, this stomach health product is another case example which perfectly integrates modern science and herbal wisdom. Ingredients involve modern science-based ingredients and herbal wisdom-based ingredients. The formula inspired from traditional TCM philosophy with herbal wisdom and further enhanced by modern science. The product is very friendly. It is delivered as portable liquid stick pack. It tastes good with flavor of citrus and rockweed. It's suitable for vegetarian and friendly for kids over 3 years old. Most importantly, this product helps in gastric mucosal health. This function has been proven by in vitro, in vivo, and clinical studies. The results from these studies have been published already. I hope all of you can enjoy the product. Thank you.